Okay, so we're resuming now.
Mm-hmm.
I have a close family member who's had the same problems for a long time, and he recently backed out of going to your wedding because of social anxiety, right?
Mm-hmm.
And I'm an uninformed member of the public, let's say, this isn't my expertise, but my gut instinct was to be like, why has this therapist had them focused on their problems so much, allowing them to make excuses because of their problems. And, it had them on medication for a long period of time and hasn't been pushing them to partake in their life as they should, And that kind of coincides with what we were talking about with your pressuring. What was it? What
Pressure, challenge.
Pressure challenge.
Of course.
Yeah.
Yeah. This is a great point, and I hear it. So if I have a patient, let's say your friend is my patient, I will often hear from family members as far as, well, why aren't we need to push them, right? Now, the question is how hard to push. Now, when you're dealing with anxiety, for instance, social anxiety. So what is social anxiety? Social anxiety, yeah, I suppose if everybody wants to take a time and guess what their definition of social anxiety is, because I hear that tossed around all the time.
Yeah, leave it in the comments.
Social anxiety. What is your definition, guys? Now, with all clinical anxiety disorders, we are overestimating the chances of a negative outcome, and we're overestimating the severity of the consequences of this negative outcome. So what is social anxiety? In social anxiety, we are overestimating the chances of being negatively evaluated by other people.
Does that manifest in embarrassment?
It can.
Ruminating on your own shame?
It absolutely can. It can. Yes, I'll tell you what a result of that is.
I should just kill myself because God damn it,
Hopefully not, but I'll get to the embarrassment and shame. We could talk all about shame too, and guilt like we were bringing up before. So social anxiety, we're totally overestimating the chances of being negatively evaluated by other people, and we're totally overestimating the severity of the consequences. Oh my God, for sure, these people are going to think I'm weird. They're going to think I'm weird, and the consequences are going to be horrible. They're going to talk about me. Everyone else is going to think I'm weird. I'm going to feel like total shit. My mood is going to suffer for the next 2 weeks. I won't be able to recover from this. Yeah. I'm going to be thinking about this for forever.
And the pernicious thing about that is that the next time you go and hang out with those people, you're going to infer all sorts of behind the scenes connotations of the way they're looking at you and treating you and stuff that just aren't true. You're going to be like, oh, they secretly hate me. They secretly think I'm a joke.
Yes.
And that look they give you, you're going to infer it as some sort of negative thing. And in reality, they're don't care at all.
Bingo.
Maybe they had some gas and that's why they made that face or something,
You're hitting on the exact right point. Again, like we were discussing earlier, everything you're saying is exactly what we work on, except in a scientific, systematic way. So you have this socially anxious person. I feel like if I go to this wedding, for sure, people are going to think I'm weird, and the consequences of that are going to be horrible, right? Now, we're not telling you that there's 0% chance that people are going to think you're weird and it's not going to be good for you. What we're saying is you're overestimating by far the chances of this horrible outcome. So one, yeah, it might happen. And two, yeah, it might be bad, but you're totally overestimating it.
And just for everyone out there, it happens to all of us.
It does.
I can't tell you how many times I've made a fool of myself, but he's still my friend.
Absolutely.
It's okay.
I've been very generous with this guy over here, actually. And people talk behind his back all the time.
Let's not make this one-sided,
Now, to your point, right, to your question. So should this therapist be supporting avoidance behavior, right?
Yes.
So what does social anxiety, how do we defend against this risk of pain? Avoidance, right? We don't go to the wedding. We don't go to the party. We don't go to the family Thanksgiving.
You're avoiding your whole life.
Yeah. Well,
Maybe.
a lot of life is social.
Mhm.
Yes, we're social animals. Now, to get to your point, so in with cognitive behavioral therapy, for instance, right? If someone is socially anxious, we want to expose them to their fear in a systematic way in which they have to utilize courage, but we don't want to flood them with fear so they have a panic attack. Now, if going to the wedding is like 9 or 10 scary, like 9 out of 10, like 9 out of 10 or 10 out of 10 scary, we don't encourage them to do that because flooding yourself with fear is actually counterproductive.
Right. If something happens, well, now you got something else to be afraid of.
Yeah. And it can be traumatizing and it can be, again, counterproductive. So who knows? Let's say going to my wedding. Now all my patients know I'm getting married. Well, at least the ones that are watching. Again, more self-disclosure here than in visits. Maybe it was right of the therapist to support them not going.
Right.
Now,
okay. Yeah. So
yes.
I shouldn't have made assumptions like that. Right. I'm talking out my ass. I'm voicing my own frustrations about the situation.
Exactly. And
But
that's
I am a professional at this. All right.
And that's the role I take. It's one of more compassion because, again, the 90% of people will have the feeling you have. Like, why is this therapist telling him to avoid the wedding? He should go. It'll be good to him. He should face his fears. But yes.
We don't know what's actually going on.
And who knows? This might bring upon panic, and this might be like a 10 out of 10 in fear. So when we want to attack social anxiety in a CBT, cognitive behavioral therapy approach, we have them come up with a list of things that's called the fear hierarchy, and we want them to go knock out stuff that's like a 4 out of 10.
Mm-hmm.
Stuff that'll
Build
bring
them.
a rise, require courage, but won't put them in panic. What you were saying before, as far as they're assuming people are like, you're looking at them sideways, part of so before they go into this exposure, 4 out of 10, we have them list what is objective evidence that your fear has come true, that these people think you're weird.
Mm.
And then what is your subjective interpretation? We don't want to count on that. Just because you feel like that guy thinks I'm weird, that is not evidence that your fear came true.
Yeah, there needs to be some actions that
What
happened.
is objective evidence?
Yeah.
Now, that's the basis behind treating social anxiety in a therapy way, a CBT way. What is 4 out of 10 scary? What's subjective interpretation that things are going wrong? What's objective evidence? Go do a bunch of times, come back. And what you see over time is that their fear gets extinguished. Something that used to be a 4 out of 10, doc, it's like a 2 out of 10, no problem. And you work your way up, and perhaps you can finally culminate with going to a wedding in which, God, a lot of people are there. You have to be well dressed. There's a certain decorum and etiquette. So who knows?
Yeah.
This friend of yours, maybe the wedding is a 4 out of 10, and the therapist is just being too supportive and not challenging and pressuring them enough. But who knows? If it's too much, they might be making the right decision.
It could be a 9 out of 10. That could be wrong, right? Like my own subjective view of it is it's no big deal. I love weddings, but it's a whole different game.
Exactly.
With someone who has a problem with those kinds of things.
Yeah, and let's mentalize this person. He's been to 3 weddings before. He didn't know how to dress. People looked at him weird. He didn't know how to interact with people. He left home. He felt embarrassed and ashamed. He led to him to be like mildly depressed for 3 weeks. It's happened over and over again, right?
Yeah.
So if we occupy his
close
point
are the
of view,
weddings? This is his 4th wedding in 2 months. That's different than his 4th wedding in 5 years.
Exactly.
Yeah.
So
and also it's got me thinking. Everybody's path is different, right? So our family expects you to be at the wedding, right? If your family didn't expect you to be at the wedding, then it might not even be a concern that you're missing it. It might be no big deal, right? But like every person has their external life, right? Their family or their friends or whoever else that expect certain things out of them. Their tribe. And so I guess it's probably part of your protocol to figure out what exactly is their specific tribe and their life's struggles with their own pressures on them.
Absolutely.
and work them towards those specific things. You know, like for some people, wedding, no big deal. It's not a defined rubric for everyone where you're like, well, to get out of my to graduate into a healthy person out of my practice, you have to be able to go to a wedding. Like, no.
Absolutely.
Right.
What you're suggesting is absolutely right. You have to have a holistic view of this person. Who are they? What does their world look like? What sort of external pressures do they have on them? Who's their family? What's their tribe? Absolutely. I couldn't agree with you more.
Yeah. And this is a great segue into what we wanted to talk about with anxiety in the workplace.
Mm-hmm.
Right.
Yes.